President, I rise to talk about the Comprehensive Addiction and Recovery Act. We had a good vote earlier today on proceeding to that legislation, and it's my expectation and hope that we will actually vote on this legislation either later today or tomorrow morning. But let me say first that this legislation called CARA, the Comprehensive Addiction and Recovery Act, also includes some criminal justice reform. It's one step closer to this broader bill that Senator Grassley and Senator Booker just talked about. I'm a co-sponsor of their bill because I do think we need sentencing reform. But actually in CARA, we have some reforms that called diversion programs. People in the criminal justice system who are addicted to drugs, instead of getting them into prison, to getting them into treatment programs. And those treatment programs have proven to be successful. We have drug court funding in particular here, specific new programs for our veterans. So the notion is this part of criminal justice reform to actually enable people who are suffering from drug addiction in the criminal justice system to move them into treatment, which makes so much more sense for them, for their families, for the taxpayers, for the communities. That's part of this underlying legislation that we're going to vote on later today, the Comprehensive Addiction and Recovery Act. But I also support the broader legislation. I'm hoping actually the broader legislation would have more to do with the prisoner reentry programs as well, the so-called Second Chance. I'm the author of the Second Chance Act from my House days, and that legislation, I hope, can be reauthorized as part of this larger criminal justice reform issue. But today, again, let me focus in on Comprehensive Addiction and Recovery Act, because this is legislation that is badly needed. It's an emergency in our communities right now. This is the heroin and prescription drug addiction issue that, unfortunately, many more people are learning about because it's affecting many more of us. I had a teletown hall last night, which I do monthly. We had about 25,000 Ohioans on the call, and we typically have a few polls that we ask. We ask about the top issues. Last night we asked how many people on the call were directly affected by the issue of heroin and prescription drug addiction. Directly affected. And we asked people to indicate that by either hitting 1 for a yes or no for a 2. 68%. 68% of the people on this call said yes, they were directly affected. We had a lot of calls coming in from people who were affected, talking about, in one case, a woman whose stepson was addicted and he was trying to get treatment and couldn't find some place and wanted me to help them find a proper place to get treatment and recovery services. Others called in about the legislation, asking why we hadn't gotten it done yet. And my answer to them was, it's coming. You know, help is on the way. And I am frustrated, as they are. We haven't moved more quickly on this. But again, finally today, we had this vote to move the legislation forward. The final passage vote, I hope, will occur either later today or tomorrow morning, and we'll be able to get this legislation to the President's desk for his signature. It passed the Senate initially with a 94-1 vote back on March 10th. It then went over to the House of Representatives, where the House worked through their own process. They had 18 separate bills rather than one comprehensive bill. And then in the period between that and now, we have had this conference between the House and the Senate to work out those differences, and that conference report was voted on in the House last Friday. It was an overwhelming vote, an overwhelming vote. Why? Because this makes so much sense. And again, here in the Senate floor today, we had a very strong vote of 90-2 on the motion to move this forward, the cloture vote, and I'm hopeful that we'll be able to have a strong vote at the end of the day tomorrow or tomorrow morning to be able to send this to the President and get it to our communities to begin to help. The legislation is, by some, considered to be inadequate because it doesn't have enough funding in it. Well, it's not a funding bill. It's not an appropriations bill. It's a bill that establishes new programs to be able to fund new and better ways to deal with addiction. And it does authorize significant new spending. In fact, since the Senate passed the bill by a 94-1 vote, only two things have happened with regard to funding. One is we more than doubled the authorization, so there's more funding authorized, $181 million per year. But second, we also had the Appropriations Committee go through its process, and both the Senate and the House Appropriations Committee acted to dramatically increase funding in this area, and that's a good thing. I think it's an emergency. I think it's urgent. I think we ought to be spending more money here because it will save money over the long haul, and because there are so many people who are not achieving their God-given purpose because this addiction has taken them off track, and we have to help them and help them now, and because we have to help keep people from getting into that funnel of addiction by spending more focus and time and effort on prevention and education. But all that's happened since the 94-1 vote here in the Senate is there's been a 93% increase over last year's funding for next year. That's, by the way, a 539% increase over the funding of just 2 years ago. And in this House appropriations bill, there's actually even a bigger increase in the funding. I will fight for that funding, and I will fight to ensure that that funding actually applies to the programs that are in this legislation, in the Comprehensive Addiction and Recovery Act, because it's the kind of legislation that's actually going to make a difference in helping to ensure that we can begin to turn the tide on this issue. The legislation before us is one that 94 senators have already voted for, and again, it passed the House with big numbers, so I'm hopeful that there won't be any roadblocks in the way of getting it done. I was asked today by some people, what does the bill really do? And I started to go through all the specific grant programs for our veterans, for mothers who are pregnant, for our kids who are born dependent on drugs, for those folks who find themselves unable to get treatment. There are specific provisions for our law enforcement personnel, which is why the Fraternal Order of Police has been a strong supporter, and I appreciate them standing up early as a law enforcement entity. But others have as well, because it provides more training on how to use this miracle drug with regard to saving people who have overdosed, called Narcan or naloxone. So there's lots of specific programs here, but I think the answer to the question as to what it does really is pretty simple. It begins for the first time ever in this United States Congress to treat addiction like the disease that it is. And this means, by necessity, if it's a disease, that we need to get people into treatment. It begins to change the way we approach addiction by saying, let's remove the stigma so people will come forward, so families are willing to talk about it. Last night on that call, when 68% of the respondents to the poll said they are directly affected by this issue, I bet many of those people have not thought about talking about that publicly. This legislation, I think, helps to establish the fact that this is a disease. This legislation also will help deal with an underlying problem, which is how we deal with prescription drugs in our communities. In our society, too often there's been an overprescribing of painkillers that are prescription drugs that are addictive. I heard another story today, and I hear them every day when I'm back home, one sort or another. This was somebody whose family member had gone for a procedure, a knee operation, and when he was done with the procedure, the doctor gave him 80 pills, Percocets. He didn't take any of them because he didn't need them, but his point was, why 80 pills? 4 out of 5 of the heroin addicts in Ohio and around this country started with prescription drugs. And often it was very inadvertent. It was something that someone had a wisdom tooth taken out and was given a number of these prescription pain pills, didn't understand the risk, started taking them. There was a physiological change in that person's brain. That person became addicted. That person then went to heroin. That person then died of an overdose. That's happened to 2 families in my home state. And those parents have now come forward, not just to tell that story and to share their grief, but to channel that grief into something positive, which is to let other parents know. That's in this legislation. We have a national awareness program to let people know about the fact that the prescription drug linked to heroin and to opioids and to addiction is real, and we must be very careful. It also, for the first time ever in federal law, promotes recovery. Treatment is one thing, but as one of my friends back home, who is someone who is in recovery, told me, getting clean is easier, but staying clean is hard. In other words, so often what we found as we did our research around the country is that people go through a treatment program, but the recovery services aren't there to take them through that longer-term support to be able to enable them to stay clean. Tragically, we save a life only to see someone overdose later again. Recovery is about finishing the job and help people to get their lives back. And it's an incredibly important part of this legislation. Earlier this week, I spoke to a group called Faces and Voices of Recovery. They've been terrific in promoting this legislation, but just as important, in letting people know who are in recovery that you have friends, that this can be addressed, that you can come out the other side as a person who is achieving your purpose in life, your God-given abilities. You can get through this. They had a rally here in Washington, D.C. I was honored to speak at it. This was about a year ago. They brought people in from all over the country, some great entertainers and people who were willing to stand up for the first time and to say, I'm in recovery. If you're in recovery too, we want to embrace you and help you. One of the advocates that I met with the other night is a woman named Sarah Nerad. And Sarah is someone I've gotten to know over the years. A couple years ago, we had a roundtable discussion as this legislation was being drafted. And Sarah told me her story. She's a recovering addict. She went to the Ohio State University. She found there was no support services there. She started a student recovery support community. That community at Ohio State University not only has a lot of people now joining it and participating, recovering addicts and family members and friends, but she is also spreading this now at colleges and universities around the country. There are grants in this legislation to promote these support communities because they work. And I hold up Sarah as an example of someone who was brave and courageous enough to talk about her addiction and therefore to get other people attracted to her and to her support group and go on to help so many other people and change so many other lives. And really, in her case, to be able to say that she is a major part of this legislation, because we included this partly because of her testimony and her stories. Until we end this stigma, we're not going to make the progress that we must. The Drug Enforcement Agency tells us that this is not getting better, this is getting worse. They tell us from 2010 till the most recent data we have, which is 2014, there has been a tripling of heroin overdoses. In my own state of Ohio, we have seen a dramatic increase. Since March 10th, when 94 senators voted for CARA, we have lost more than 14,000 Americans. Think about that. Since March 10th, more than 14,000 Americans have succumbed. In other words, they have overdosed and died from heroin and prescription drugs, opioid overdoses. And unfortunately, that's just the tip of the iceberg. As horrible as those numbers are, the 14,000, and as overdose deaths are, think of all the casualties. Think of the 16,000 people in Ohio who've been saved from overdoses from Narcan. But for many of them, they have not gotten into treatment. They have not gone into recovery. They continue to be broken apart from their families. The drugs are everything, not their kids, not their parents. They continue to be unable or unwilling to work. They continue to be committing crimes. In most communities in my home state of Ohio, law enforcement will tell you that the #1 cause of crime is this issue. They continue to be unable to, again, pursue their God-given abilities. That's the casualties of this. No one suffers alone. In Ohio, we're told that 200,000 people are now struggling with addiction. That's the size of a major city in Ohio. Many of those addicted are parents. We're told that 30%, think about this, 30% of all kids in Ohio who are in custody of the state are there because their parents are opioid users. Among infants, that number is 70%. 70% of the infants who are in custody of the state in Ohio are there because their parents are opioid users. I call that an epidemic. It's driving up crime. As I said, in Marion, Ohio, Police Chief Bill Collins put it this way. He said, all of the property crimes we have, the shoplifting, the theft, the robberies, all go back to one thing, and that's heroin. That's a quote from him. He says, this epidemic makes him and other law enforcement officials feel like they're in an ocean without a life jacket. That's what we're trying to do with CARA, is to provide that life jacket. It's not the silver bullet. It won't solve all the problems. Washington is not going to solve this problem. It's going to be solved in our communities and in our hearts. But this will help. It will help make the federal government a much better partner with state and local government, with the wonderful nonprofits that are doing the good work, and with the families and the communities. Last week, in just one 36-hour period in Akron, Ohio, 20 people overdosed on opioids, 3 of them fatally. That's not even 2 days in one city. When the first responders arrived at one of the overdoses, by the way, there were 2 small children present. In central Ohio, in Columbus, 9 people overdosed, 2 of them fatally on Sunday. That's in one city, in one day. 2 of those occurred at a McDonald's, by the way, with families around. It was in broad daylight. A few months ago, we lost 7-time Grammy Award winner Prince to a fentanyl overdose. We all know about Prince. You might not know that this week, 10-time Grammy Award-winning singer Chaka Khan checked into a rehabilitation center for fentanyl addiction. I want to commend her for having the courage to admit she needed help, for taking the steps very publicly necessary to get her life back on track. This will help others to do the same thing. God bless you for doing it. I think this is, sadly, an instructive case, because much like Prince, she has fame, she has fortune, 10 #1 hit songs, all of the talent you could ever ask for. Most people would say, those aren't the kind of people that get addicted. Addiction knows no zip code. Addiction spares no one. It affects people of every single background. Mr. President, if you talk to people in Ohio, they get it. Ohioans understand the scope of this epidemic now, and they're taking action. They expect us to help and to take action, too. That's what this legislation is about. They couldn't believe how slow we've moved on this. They couldn't believe these ideas that we might try to delay this further for reasons that had nothing to do with the substance. The Talawanda School District outside my hometown of Cincinnati, Ohio, announced last week they're now adding to their health and wellness curriculum key information about opioids. I talked to a couple of superintendents today who are doing the same thing in their schools. I believe it's critical to preventing overdoses from beginning in the first place by using better prevention and education, keeping people from getting into that funnel of addiction, and that's what's happening. CARA supports this. In Trumbull, Ohio, more than 200 Ohioans participated in a walk against heroin over the 4th of July weekend. Again, people are starting to take action. I know that it can be very discouraging. The scope of this problem is overwhelming. But boy, there's hope. Treatment can work. Recovery does work. And if we can get this legislation to the president, I'm confident he'll sign it into law, and in many more of our communities, we'll have better treatment, we'll have better recovery, and more hope for the people we represent. I want to thank Senator Sheldon Whitehouse for his work with me on this issue. He has been the co-author of this. We started more than 3 years ago holding conferences here in Washington, D.C. We had 5 conferences. We brought in experts from all over the country. People who I talked about earlier included from Ohio, but every state. We talked about how to actually make a difference in communities around the country. We didn't care where the idea came from, Republican, Democrat, Independent, it didn't matter. It mattered whether the idea made sense. Sheldon Whitehouse and his staff have done a terrific job in keeping this bill moving, ensuring that we didn't get off track. I also want to thank other colleagues who have been helpful, especially Senator Kelly Ayotte and Senator Amy Klobuchar for their passion and for their help in crafting this legislation. The American people are tired of the partisanship. We all hear that. We all know that. It's time for us to act. I also want to thank some of the staff who have been so helpful in this legislation, who put their heart and soul into this effort, including Megan Harrington, Pam Thiessen, Mark Kozakowicz, Terry Geiger, Brian Riedel, Alan Ertz, Sarah Schmidt, of my staff. I'm proud of their work throughout this process. I want to thank all the advocates we've worked with all across Ohio and all across the country. They've been here in Washington. They helped us to get the great vote in the House last week, and they're working today on the vote tonight or tomorrow. Jessica Nicola, I want to point out in particular, who has helped to keep us all moving in the same direction. The outside advocates have been terrific. But last, I want to thank those who have shared their stories. And most importantly, I want to thank them for their willingness to allow us to hear from them. These are people who are in recovery. These are people who are in the trenches, dealing every day with this issue, who are providing the love and the attention and the support to help people get through treatment and into recovery. These are our first responders who are out there on the front lines dealing with this issue every single day. These are our doctors and nurses who find our waiting rooms and our emergency rooms are filled with people who have addiction problems and overdoses. These are the people who work in the neonatal units with these babies who are born dependent, a 750% increase in my home state just in the last 12 years, and they take these babies through a recovery, a treatment program to get them so that they can be healthy and back on track. I want to thank all of them. I want to finish with a story, Mr. President. About a year ago, I visited a treatment center in Ohio. I've been to more than a dozen treatment centers in my home state to talk about this issue and to get ideas. It was the ZIF Center, which is a center in Toledo, Ohio. And I had asked if we could have a discussion, a roundtable discussion. And sure enough, we did. And at this roundtable discussion, some people came forward who are in recovery. There were about a dozen people there. And again, I congratulate them for coming forward and for being willing to talk to me and to be public. There were people there from the community who heard their stories for the first time, and they did share their stories. But also, Mr. President, they came ready to talk. They had reviewed the draft legislation. They had it in front of them. They had ideas. They had input. They had looked at every single section of the bill. They knew what programs were funded. They talked about what they thought worked and what didn't work in their lives. And it was an example of the process we went through with this legislation. It wasn't just a bunch of people here in Washington saying, we know what's best. It was people back home saying, we need this help. We want to be sure you do it right. And by the way, keep it nonpartisan. make sure we get this done. Don't let anything get in the way. That's what we've done. That's what we'll do tonight or tomorrow morning we vote on this bill. That's why it's so important we get it passed, because it is those recovering addicts at the Zepf Center and others around the state of Ohio who have patiently waited for this legislation. It's now our duty to deliver that legislation and help us turn the tide in this epidemic.